Hi, I'm Casey Glade, and this is my return demo for cranial nerves for NR304. Okay, so we're going to start with cranial nerves 3, 4, and 6. The cranial nerves 3, 4, and 6 are the ocular motor, the trochlear, and the abducens. So to test those, we are going to assess PERLA. To start assessing PERLA, we want to look at the pupils. We want to look at the size of the pupils, and we want to make sure that they're both equal and they're both round in shape. So this is where I would take my pen light and I would measure the pupils with the measurement here. I would also want to check and see if they are reactive to light. So I would do this both indirectly and directly. So directly, we will be looking at the pupil and we want to make sure that it's constricting as we're doing this. So direct light, I want to see if the pupil is constricting. Shine it over here. See if the pupil is constricting. Now we're going to shine it in the eye again, and we're going to look at the opposite pupil for indirect light. And then both pupils should constrict when the light is put in. And next we're going to check accommodation. So I will have the patient, I will hold my pen out and I'll tell the patient to focus on the pen as I get closer to the face, and the pupils should look down and focus on the object as it gets closer to the face. And then the last thing we're going to do, we're going to do the 6 cardinal gazes. So I would tell my patient I'm going to hold the pen out here, and then the patient is just supposed to look at the top of the pen at all 6 points. So I'll start here. Okay, good. So according to my assessment, cranial nerves 3, 4, and 6 are all intact. Alright, so the next will be the trigeminal, which is cranial nerve number 5. To test the sensory portion of that, the motor portion, I would have the patient clench their jaw. I would feel here, you want to feel both sides, the muscle, and then you would want to press in a little. And then if the patient's jaw drops open, that's a problem. According to my assessment, the trigeminal nerve is intact, but also I want to do the other test, the sensory portion. So I would have the patient close their eyes. I'd have them close their eyes, and I would feel them along here, along here, along here, and I would have them say now when they feel it. So now, 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 now. So you could do one at a time. Okay, according to my assessment, the trigeminal nerve is intact. So next we'll move on to the facial cranial nerve, and we'll test the motor function by having the patient smile, frown, lift eyebrows, and blow up their cheeks. Patients should be able to do all of this equally. All should look symmetrical as they're doing this. There should be no deviations to one side. So according to this test, the facial nerve is intact. Next, we'll do the vestibular cochlear, which is number 8. To test this, we would stand 2 to 3 feet behind the patient, and we would cover one ear, and we would whisper a 2-syllable word, Daisy. And then we would make sure that the patient could hear in the opposite ear, and then we would switch, cover the other ear, whisper a word, Daisy. And then we'd see if the patient could hear, and if patient could hear, then cranial nerve 8 is intact. Next, we'll move on to number 9, which is the glossopharyngeal. To do this, we would have the patient swallow, and we're checking the gag reflex to see if there's any difficulty swallowing, any signs of choking, any coughing, anything like that, and I didn't see any, so cranial nerve number 9 is intact. Next we have cranial nerve number 10, which is the vagus nerve. So to test this, we'd have the patient open their mouth, look and say ah, and we would look at their uvula. And also at the same time, I'm going to combine cranial nerve number 12, which is the hypoglossal, and I'm going to look at the tongue also as the patient says ah, and assess both. Ah. So according to my assessment, since both were symmetrical, the tongue didn't deviate to one side, uvula is midline in the throat, I would say that both the glossopharyngeal and the hypoglossal cranial nerves are intact. So then that leaves us with cranial nerve number 11, which is the accessory nerve. So I would have the patient shrug their shoulders, and I would put some resistance and have them shrug their shoulders. And if they can't do that, then there would be a problem with the accessory nerve. And then another one is I would put my hand on their face and I would have them turn and do it to the other side. And if they have any issues with that, then their accessory nerve would not be intact. So if they were not able to meet my resistance, then there would be an issue. I think that's how I was trying to explain it. Okay, and that will complete our cranial nerves. Thank you.